Okay, good afternoon, everybody. Welcome to our learning opportunity for the Plains to Peaks Regional Network. It's May 18th, 2020. Thanks for joining. I hope everybody is hanging in there, balancing work and life at home. There we go. I wanted to start with introductions and a little icebreaker, and then we'll go into today's discussion. We have a couple special guests from Texas, and I'll let them introduce themselves and talk about the work that they're doing, and then hoping we can have a discussion about the impact of COVID-19 on our injury and violence prevention work, and what maybe support and resources we could provide to each other in the coming days and months and probably years of addressing those potential impacts. So to start introductions, what I'll probably do, if it's okay, is read down the list of participants, which I'm just trying to pull up here. Sorry, bear with me on the multiple screens, just because there's quite a few of us, so we don't talk over each other. But if you wouldn't mind sharing your name, your role in your organization, and then a highlight from this past weekend, that would be great. So I will start. I'm Colleen Capsamalis-Doyle. I'm the Program Integration and Evaluation Unit Manager at the Colorado Department of Public Health and Environment in our Violence and Injury Prevention branch. And one of my highlights from this past weekend, and I hope you don't mind indulging me with this photo, but my son Devin turned 1 on Friday. So we celebrated his first birthday with a hike and a Zoom happy birthday call with his grandparents and cake and all those fun things. So it was an exciting milestone for us this weekend. So next, Sarah, would you mind going next?
Sure. Hold on, let me turn my video on.
Thanks.
Hi, everyone. So I'm Sarah Brandspiegel. I'm at the Colorado School of Public Health. I work on the program for injury prevention, education, and research. Most of my work has been on suicide prevention and child maltreatment prevention, but I kind of do a little bit of everything. And I'm glad to be here today. My highlight from the weekend was I picked up about 20 different native plants and planted them all in my garden, and I'm hoping to get lots of birds and bees, and that was exciting.
Awesome. I'm hoping to do that next weekend a little bit. Next, how about Ashley?
Hi, everyone. I'm Ashley Nix. I'm with the Colorado Department of Public Health and Environment, and I work on motor vehicle safety as the program coordinator. And she, hers are my pronouns. And a highlight from this past weekend, probably ended up making a really nice dinner for me and my husband. I think it's become really easy to kind of eat the same stuff over and over again. So we just kind of took some time for ourselves and spent time in the kitchen and just made ourselves a really fancy pasta dinner. And it was really great. Thanks.
That sounds nice. Barbara?
Hi, everyone. I'm Barbara Gabella. I'm an epidemiologist at the Colorado Department of Public Health and Environment, where I work on emerging issues for violence and injury and mental health promotion. And my highlight is I'm finally seeing progress in my manual labor. And that is, I've been digging dandelions for several weekends. I will never win the battle against nature, but I can see progress.
That is hard work. I saw someone that I don't know personally, but I'm on this cooking while quarantine group that my friend started, and someone said that she baked dandelion cookies with her kids. So that's a thing if you want to look that up, but it sounds like the verdict was that it wasn't really worth the effort and just to make shortbread cookies in the future. So you'll have to update us next time if you go that route. Okay, next, Sherry.
Hello, I am Sherry Sage. I'm the State Director for Safe Kids Kansas, And our lead agency is the Kansas Department of Health and Environment. I am also the Preventive Health Block Grant Coordinator. Last weekend, I'm sensing a theme here. A lot of people got outside and gardened, and I did the same thing. So I went out and planted tomatoes and basil and rosemary and all of our favorite herbs. And so really excited for when we get to start eating on those this summer.
Cool. Thanks for sharing. Next, Dana.
Hey everybody, I am Dana Zolk. I'm the Section Director for Injury and Violence Prevention Programs at the Kansas Department of Health and Environment. And this was the first weekend in a very long time I had a moment just to stop and actually breathe, which was followed by some fun times with my grandbabies.
That's nice. Next, let's see, Jamin.
Hi, I'm Jamin Johnson. I'm with the Wyoming Department of Health. I manage the Child Health Program and the Children and Youth with Special Healthcare Needs Program. And injury is one of my Title V priorities. And over this past weekend, I had my first water fight of the season with my boys. It was still pretty cold, but it helped me win. So that's me.
That's fun. Okay, next, Kate Cohen.
Hi, I'm Kate. I work on policy and communications at the Colorado Department of Public Health in violence injury prevention, mental health promotion. And I think my highlight is that for the first time since social isolation started, we got takeout that we're going to heat up tonight for dinner. So I'm pretty excited not to cook for the first time in months. But
Wow.
Yeah, so that's exciting. Oh, and my pronouns are she, her, hers.
I'm so impressed you held out that long. That's a lot of cooking in the house. So good job.
Well, it makes me happy to cook, so it's like it's like a thing to do.
Yeah, that's awesome. Lisa.
Hi, everybody. I'm Lisa Roth, and I'm the Deputy Director at the University of Iowa's Injury Prevention Research Center. And I don't know if it's a highlight or what, but my husband and my son got quarantine cuts by my hand this weekend. So I taught myself a new life skill. I wish I had a before and after picture to show you, but just they look much better. They were getting pretty shaggy. So that was a highlight because they look good.
Good for you. That's great. Next up, Mandy.
Hi everyone, Mandy Slegg, North Dakota Department of Health, Division of Injury and Violence Prevention. I guess my highlight was it was beautiful out during the weekend, so we got out, rode bikes, and played Frisbee. It was awesome.
That's great. Let's see. Allie?
Hi everyone, I'm Allie Maffey. I also work at Colorado Department of Public Health and Environment and manage a couple, our CTC program, Retail Marijuana Education Program, and our Healthy Kids Colorado survey. My pronouns are she, her, hers, and I was super excited to get out this weekend. We took our twins out on Strider bikes, and they're making some progress. They're pretty young still, so. And then we made it a couple miles on the Colorado Trail up near Bailey, which was just really nice. And we saw like next to no one, so it was perfect.
Nice. Let's see, Rachel?
Hi, I'm Rachel Brown with the Colorado Department of Public Health and Environment. I'm a temp in violence injury prevention, mental health promotion. And my highlight from the weekend was I got an unexpected piece of mail from a friend. She drew me a bunch of pictures of frogs because I really like frogs and mailed them to me.
That's really cool. It's always nice when you get not bills or like other mailer kind of junk mail in the mail. Peg, do you mind going next?
Sure, I just have to go off mute. My name is Peg O.G. Ginsberg. I'm the Interprevention Program Manager in Nebraska. Let me see. Well, I just had a chance to talk with some friends yesterday, so that was really fun. Some people I hadn't talked to for a while.
That's great. And Jeannie?
Yes, Jeannie from Nebraska Injury Prevention Program, and my highlight is getting our camp ready to go camping.
That's fun. I know that's what we're hoping to do some of that this year too.
Yeah.
Sorry, I'm just trying to pull up my Ashley. I think you're on.
Hi, I'm Ashley Barkley. I am with Kansas Department of Health and Environment. I work with Sherry at Safe Kids Kansas. My highlight was I got to spend all day long, all weekend long with all 9 of my children in one place, and got to do some crafting that I always enjoy doing.
Great. Okay. Did I miss anybody, kind of normal regional network members? And Shelly and Kevin, I thought maybe you could go last, and then I'll have you transition into highlighting the work that you're doing in Texas. Is anybody else that I missed? I see there's a couple phone numbers, but maybe those folks already spoke. Okay. Shelly, do you want to introduce yourself? We'd also like to hear your highlight from the weekend too. So.
Sure. I'm Shelly Stevens Stidham from Dallas, Texas. I am at Parkland Health and Hospital System here in Dallas, and Kevin and I are very excited about the fact that we get to join you and talk about some of the stuff we're doing in Texas for the past few weeks. And probably my highlight is the same as Peg's. I was on the same call she was yesterday and got to visit with some folks in addition to Peg. So
that's great. And how about you, Kevin?
Okay. Hi, I'm Kevin Ricks. I work at the Del Seton Medical Center at the University of Texas down in Austin. Highlight of my weekend, we had thunderstorms here this weekend in Austin, so I organized every closet in my house, and that was much needed. It was so needed.
Congrats. That is probably not a small feat if they're anything like my closets. All right. Well, Shelly and Kevin, I'll pass it off to you. Hopefully everybody can see the slide about the injury prevention tabletop conversations that you all are organizing. But go ahead and we'll definitely have time for questions if people have them, or a little discussion.
Sure, thanks. Kevin, if you don't mind, I'll start us off and then I'll pass the baton on to you. But in 2016, we organized in Texas a collaborative called the Texas Injury Prevention Leadership Collaborative. And this was, and the idea was that we were going to try and build our workforce by teaching some leadership skills. And I heard somebody talking about yesterday that, you know, often we call these leadership skills that are the soft skills, kind of the active listening, the mindfulness and things like that. And someone I was talking to yesterday actually called them power skills. So I like that much better than soft skills. But Texas is not a core fund. We do not have core funding from CDC for the SVIP grant. So, and our injury program at the State Health Department has kind of been in flux for several years, but is really gaining some traction. And I think they're probably hoping to apply for some core SVIP funding the next round. But Kevin and I, along with several other colleagues from different hospitals, sort of put this injury prevention leadership collaborative together to kind of just, as I said, assist in building the workforce, but also assist the State Health Department, their injury program, in having some resources that may not be available to them. So the collaborative has been kind of plodding along for the last, well, since 2016. In the last, well, I think we're at now week 9 of working from home. And during that time, Kevin and I started having some conversations about are there some cool, innovative things that we could be doing to really engaged the collaborative. We've got a listserv, and we've provided a few webinars and things like that. And honestly, I was scrolling through Instagram one day and I saw a conversation between Jenna Bush Hager and Reese Witherspoon on their book clubs. And I thought maybe we could do something like this, just start having some conversations. So this is the nice thing about having young friends. I think I sent Kevin a text and said, hey, do you think that this is something that we can do? And Kevin, as he usually does, says, yeah, this sounds like a fun deal. So we recorded we decided to record just a practice session, and involved Dr. Jamila Porter at Safe States. And Kevin utilized his editing skills and kind of put it together in a quick video. And then we sent it out to our strategy team and said, is this something you guys want to post and continue to do? And we got a lot of positive feedback on it. And so we're at this point trying to record and post conversations and post every day, not every day, but every Monday. And so Kevin, I'm going to let you talk about kind of the purpose behind the conversations. And
Sure. Thanks, Shelley. Yeah, so as Shelley mentioned, this certainly started with just us people here in Texas figuring how do we engage more professionals right now, especially when we can't get together. But as we start exploring our conversation, if I look off to the screen, because all your faces are to my right, as we start exploring the topic more, we realize this is a way that we can be more collaborative, not just with our people in Texas, but our people across the U.S. and get different perspective. So kind of the point of our conversations are to have higher level thoughts and higher level conversations among injury and violence professionals. With that said, what that kind of means is that we're not asking people to talk and give educational points about drowning prevention or motor vehicle safety. We know there are people who are exploring that in their own work and how they go about doing this. This is really a way to engage people who are just working in the field at a higher level. With that, so our first two conversations, injury prevention leadership in the age of COVID and the impact on community engagement during COVID-19, have been very COVID-focused conversations that we've published that are available on YouTube right now. So you can see kind of what we're talking about. The idea behind the conversations is that we engage 3 to 4 injury prevention professionals at a time, and we record them kind of like they're having a dinner conversation around a specific topic. That's kind of the idea, is that we're not looking for people to have preset points or try to get their point across, but just how would you engage over these bigger topics. So the first 2 conversations we posted had some kind of COVID spin to it. The one that was actually posted today, which isn't on this slide because I sent them the slide last week, and Colleen put it in here. Thank you, Colleen. This week's conversation is 3 doctoral level public health professionals talking about the impact of pursuing their doctoral degree as they move forward. So no COVID topic whatsoever. There's 3 doctoral people. Next week, there probably will be back to a COVID spin as we try to talk about what this time is. We're shooting to have these videos between 8 to 12 minutes in length because people don't have super long attention spans. We're not asking for these long lecture dialects kind of things. We're looking for short videos that people can try to get some engagement out of. And right now we're looking to build our perspectives, not just from our Texas people, but from professionals around the country. We talked to the West Coast Injury Network on last Friday. We've sent emails out to the East Coast and responded, obviously South by Southwest or South and Southwest group. They've started pushing these videos out. Safe States has been pushing these videos out. It's on, our first one is on Safe States Twitter feed today, if you happen to see that. And so we're not looking to have this just be Texas because we know there's value in the conversation, not just here in Texas, but from people who have outside perspective than Texans. I mean, I'm not a Texan and Shelley isn't a Texan either, but we just happen to live here now. So we want to get as much feedback, and we want people to be able to view the videos and get value of them, not just from Texas. Because we know we can reach our Texas people pretty easily, but we want all of you to be able to feel like we're engaging a larger professional network of injury violence professionals.
And I would just add that the videos literally are to try and stimulate conversation and try and model some of those power skills that we've been learning in terms of active listening and empathy and things like that. So we would love for you all to be part of the conversation too. We'd love to hear feedback from you all. If you have topics that you'd like to see discussed, if you'd like to volunteer for a video, it usually we record right now because both Kevin and I are working from home. And most of the people that we're recording, our schedules are pretty flexible. It usually takes about 30 minutes to record, and that's just for us to give kind of an overview to begin with. We spend about 10 to 12 minutes recording, and then I hand it off to Kevin, who edits, and we post on Mondays. So we'd love to hear from you guys.
I have a question. Do you have topics like mapped out over the next few weeks? Like I'm thinking about the doctoral topic that you posted today. I would imagine that you recruited people who have gone through that experience. So, and if so, is that something that you could share and maybe as a way to get volunteers to attend, or is it more organic than that?
It's probably, we do have some ideas, and I have no problem sharing. I think Kevin's got them on his whiteboard at his house. But I mean, it's also pretty organic. We're making decisions. We're making, we had some ideas and we've scrapped those few ideas and come up with different ones. And but yeah, we're happy to share what we have.
Yeah, and also the kind of idea behind them is we'll give out the broader topic of it, but we don't want to get super focused into one specific thing about that. So the PhD one came across, and we're like, okay, what could be academically focused or something like that. Whereas we want people to not come with preset points, but the general idea of it, we'll be happy to share all the ones that we're having. We have stuff listed out, at least another, I would say 8-ish weeks of material that we could use, but because we're trying to be really flexible about it, we're willing to change and we're adapting as we go. We don't have to so we're recording 2 videos right now this week. We recorded one this morning. We're recording one later in the week. We haven't figured out which one we'll release first. It kind of depends on the conversations and things like that. So the other thing I would say about these is that we know a lot of injury and violence professionals are having a hard time doing their typical community engagement and getting their organizations out there. And being in these videos provides you an opportunity and another way to get your organization out on platforms while everyone's mostly stuck at home.
And I think one of the things that we heard from some of our members is that they're being pulled into other jobs, contact tracing and things like that. And there's some concerns about how do they keep the importance of injury and violence at the forefront of some of these discussions. So that, again, that was another way of us trying to do that with these tabletop conversations.
Thanks for sharing that. Does anybody have any questions? And I can also, I'll definitely email out this information. And Kevin, if you want to send me the video from today, I can add that to the email to the group as well.
Yeah, sure. And if you just happen to go on YouTube and you search Texas Injury Prevention Leadership, it has its own page and you can get all the videos straight from there. But I'll send you the link in addition to the updated list of kind of the topics that we kind of have discussed.
This is Lisa in Iowa, and I think this is a fantastic idea. I love the format, and I love just the opportunity to have it in a more, casual environment, but yet getting some really important information across. Just as an aside, I wonder, topic areas, one of the things we've done is focused on some rural injury prevention with the COVID outbreak. So I just want to throw that out there. If you decide to go that direction, we could probably provide a content expert if you have a conversation that might steer in that direction, and maybe you've already addressed it and it's coming up. The other thing I wonder too about is kind of this research to practice conversation that could occur as well. It doesn't necessarily have to be COVID. It could just be some examples of the partnerships that exist in the field and are advancing injury prevention work forward. Thanks.
Thanks, Lisa. Good suggestions. And no, we don't have a rural focus yet. Kevin and I both live in urban areas, so thank you for that.
I don't know where I live. I live inside 850 square feet of my apartment all the time.
Well, that's great. I agree with Lisa. I think this is a really innovative format to have some of these conversations, and keeping them kind of at a shorter length probably is good right now, just given all the different directions we're being pulled in. So, so happy to support and like I said, to share this information further with our network. And I hope that our network members will consider volunteering to be part of the tabletop conversations going forward.
Thank you.
Thanks, Colleen. Kevin's email address is on the slide. So please reach out to him if you've got ideas, and please consider sharing the videos and subscribing to the channel.
Yeah, you'll get, especially as we go forward, you subscribe to the channel, you'll still get updates. And maybe not everyone's interested in you. PhD one is very specific for those who potentially want to go into academia. If other things may be more interested in you, and again, they're not Texas focused. They may have Texans in them, but they're focused around a lot of different things.
Yeah, good to know. Thank you.
Thanks, guys.
I'm not sure if Kevin and Shelley, you're going to stick around. You're welcome to, but we are ourselves going to have a discussion around COVID-19. So feel free to stay on, or if you need to have other priorities or other work to do, you're welcome to log off as well. Just thank you for coming, and I'm glad that the timing worked out, because I know that you just reached out to me last week.
I'm probably going to log off. Have a good day, everyone.
Yeah.
Got another call coming up.
Okay, thanks, Shelley.
So live, but thank you so much. You guys have a great day.
Okay, bye-bye. Okay. So transitioning, and I haven't actually personally watched the YouTube videos yet, so I think that the two videos that they've already, or tabletop conversations they've already had around COVID-19 and the impact on community engagement and leadership may be relevant as follow-up to some of our conversation today. But I did want to connect with everybody around, discussing the impact of COVID-19 on injuries and violence. And part of the reason that this conversation came up is that when I met with the, on our off monthly call, the core funded states and then other state designated reps, that was back in probably the first half of April. So I think we were all still just entering the space of being at home and really understanding or just experiencing the impact of COVID. And so I thought that it might be timely to have a further conversation. And I know for us in Colorado, this is coming up. And so I'm really curious around what your experiences are like. I have some discussion questions here, but we can also start from any place that anybody is feeling like they want to start. So we can start with that first question around the impact that COVID-19 has had on our injury and violence prevention activities.
This is Dana in Kansas. We certainly have seen impact with in multiple ways. Of course, many events and activities being canceled, but yet still the need for injury prevention resources and violence prevention resources. The change to virtual meetings is less than ideal, but for me, the hardest thing has been finding the right balance for continuing injury and violence prevention activities, but responding to COVID, knowing that our data is going to reflect, I feel like, pretty drastically the increased need for injury and violence prevention efforts. And then, wondering what is funding going to be like moving forward, and are we going to have increases in child abuse and suicides and other other things. And then, you know, for our kiddos at home, our emergency department data and information from the Poison Control Center have shown, like other states across the nation, that we have a problem with active supervision and kiddos getting into things that they shouldn't be. And I think we'll continue to see our data change and reflect such need.
Dana, has Kansas already been seeing that data with the emergency department visits?
A couple of weeks ago, we received an update from Essence, which tracks our emergency department visits, and poisoning was one item that had seen a little bit of an increase. I haven't received an update recently.
Yeah, that's interesting.
So this is Barbara. I'll tag team since one of my duties is to help with injury surveillance, and I appreciate hearing that story because we do have syndromic surveillance, but because staff that work on syndromic surveillance has been completely focused on COVID, it's hard to get them to use Essence to look at the injury and violence ED visits. I do know that the National Syndromic Surveillance System does have CDC queries for Essence that we could be using to look at intimate partner violence, for example, and child abuse and neglect, but we haven't been able to get that information. So it's an odd position to be in when it's a good time to have rapid information, and yet we don't. Most of our injury surveillance is retrospective and a year out. So that's a challenge for me and my team. And then we just started talking with one of our colleagues who traditionally looks at poison control data. So I'll follow up with them, and because I like the suggestion to look at poisoning in that real-time system too. So thank you for that.
I think that points around, usually our data being retrospective makes me also think about, I know that the National Center for Fatality Review and Prevention, which runs child death review technical assistance at a national level, they're adding some questions to their national case reporting system around COVID-19 related deaths of children, both directly and indirectly, which I'm guessing is some of those things like due to lack of supervision or others of injuries, other injuries and violence. And but again, a lot of that, at least especially in Colorado, it is pretty retrospective. We don't get that. Usually we're about a year behind in reviewing the deaths of children. And so as an example, the end of calendar year 2019, Colorado had just finished 2018 reviews. So I don't know that we would, overhaul that system to review those deaths sooner. So I think exploring other options such as syndromic surveillance or poison control data or Essence to really look to see, shifts in data around injury and violence outcomes is probably something that that we could be doing.
I think the other thing to note is, people aren't necessarily going to the emergency room in a timely manner like they should.
Mm-hmm.
And we're seeing, I also worked at a domestic violence shelter on the weekends, and we answer the statewide hotline, and our phone is not ringing off the hook. We are not having clients come into shelter. I think it's along the same lines. There's great fear with entering any unknown sort of environment, or an environment that you can't control yourself, and so avoiding necessary services.
Yeah, that reminds me that's a really good point, that not only are a lot of the traditional data sets retrospective and very delayed, but even if we're going to use real-time ED visits from syndromic surveillance, I know I've seen the Colorado data in general from that for all cause. And during these stay at home or safer at home phases of the response, the number of ED visits is like 40% of what it usually is. And similarly, there's been a huge drop in EMS calls. So traditionally, we used, healthcare data systems, and during at least the formal response, that's not happening. So I think we'll have to change our methods in terms of what kinds of denominators. We traditionally use population, but we may have to actually use, the data set itself as a denominator, the total counts, to be comparable. And then I wonder, both of you have sort of alluded to the fact that there could be a second wave of results due to economic hardships as that ripples through the particular population or location.
Yeah, definitely. Yeah, I haven't even thought about that we usually use that data to track numbers, but if people aren't visiting, the ED or EMS calls are down, it's even hard to have a sense of what the true impact is. What other thoughts or experiences do others from other states have?
This is Mandy in North Dakota. I'm wondering, because trying to get out poison prevention messaging, we're working with our partners, the Minnesota Poison Control System, to try to, they're tracking our calls, and we've had a slight increase in certain calls. So we're trying to get out social media posts related to that, but I'm wondering if anyone has experienced the inability to be able to post, because in North Dakota, we just have one Department of Health page. We used to have a separate injury page, but due to various reasons, we don't have an injury page anymore. So we just have a Department of Health page. So we have a lot of competing interests, even though I feel like it's very COVID related, and trying to express that to people sometimes doesn't always work, and sometimes that messaging doesn't always get out. So I didn't know if anyone else is experiencing something similar to that.
I don't know if Colorado has, other than I can just share that I know that everybody who has any sort of communications role within our department, I think, is pulled into the response, and so likely doing communications work specific to COVID-19. And I guess if that was something we were going to pursue, we probably would need to message in relation to COVID-19 as well. But I don't know. We haven't run into that personally. Have other states experienced anything like that?
I think around communication and other things, this has been particularly hard because of so much unknown. So we've been in scramble mode. And as we're scrambling, we're finding that some resources and things already exist that we should be taking advantage of. And so it almost feels like initially we're wasting time trying to come up with communication and other efforts. And then finding, that they're already in existence. So I think that responds to one of your questions about resources and information or support.
One of the other things we just, so Safe Kids Kansas has its own social media. I'm hearing a reverb here. I don't know if you guys are, but
oh, it's better now.
Okay. So we have our own social media platform, even though the Kansas Department of Health and Environment also has a page. So we have some autonomy there. But like we just sent out a news release last Friday about this is National Safe Boating Week. So we wanted to start talking about water safety. We know there are a lot of people already going out on boats because they see it as this ultimate social distancing, like I can do this, and everybody's got cabin fever and or they're all getting a little weird. But we also just had an outbreak from an event earlier in the month at one of our very popular local lakes. So one of the things that we've done is make sure that we're incorporating into our news releases about COVID, reminding people if you're going to go out boating, wear a life jacket, and make sure that you're still socially distancing from people. So incorporating that into other messages, you know, obviously home safety became an issue as you know, the schools let out for the year right after spring break. You know, kids being left home alone. You know, a lot of our messages were still like the substance of them was still true, but we just spoke about them at a little bit, you know, with a little COVID tint towards it. So I think that there's people are also very fatigued by the COVID message. So I think kind of in getting into our specific niches, you know, whether that's, you know, parents or I know we were able to kind of get through some messages to some of the schools. Not all of them are sharing this, but just kind of like, you know, there are resources that are out there. We reminded people about Bike to School Day. We weren't in school, but it was Bike to Anywhere Day. So just, you know, we're just doing things differently. But I think the most important thing is figuring out how are we going to deliver programs remotely, and having focused so much on everything that we're doing is an evidence-based program, and we are implementing these in a very specific way to, you know, maximize the experience that our families are getting. And we're going to have to figure out how to do things differently, how, you know, what is good enough, since we can't implement things in a perfect way. I mean, so for example, a virtual car seat check, which I did my first one, and it was really, really awkward, I'll be honest. Going from being able to be hands-on with a parent right there and showing them, and then going virtual was really uncomfortable. I mean, I've been doing these for like 20 years now. So, but we've got to find a different way of doing things and making sure that we find a way to deliver the different programs, and getting creative in that. So that's the challenge that I see, is we have to find a different business model.
Yeah, I'm wondering too, what that makes me also think of, because you mentioned that these are often evidence-based programs that you're delivering in a different way, is there space or opportunities to evaluate that delivery, and just to see if it continues to be effective, and if so, what does the future look like for service, you know, for delivery of programs too? I mean, even after you know, the COVID-19 pandemic settles down, hopefully, do we still continue this model of like in-person and virtual, and does that expand our reach to communities that don't have as much access to programs in person? So. In thinking about the shift in how to deliver programs, I'm also curious if the response has resulted in any delays or loss of funding to our regular program activities, and what that looks like, if that's occurring.
This is Mandy. I know that one of our contracts is the Consumer Product Safety Commission. So the recall effectiveness check, some of you guys probably do that within your programs. And I know those recall checks require in-person visits. So we're not doing those right now. I mean, it is a little contract, but that would be a potential loss if we weren't able to complete those visits and do that contract.
Mm-hmm. Yeah, I think for us in Colorado, a lot of our local public health agencies who we generally contract with to do injury and violence prevention activities across different topic areas are just really pulled into the COVID-19 response. And so their ability to complete the other types of injury and violence prevention work is really limited, because they have limited capacity. So for us right now, I think that results in delays, and hopefully the project work can continue next year, but but things are not happening in the same way. I know that Safe States Alliance has a lot of COVID-19 resources and support that they're offering, and actually the Sherry, your mention of the drowning prevention work reminded me that I think that they actually even have a learning opportunity webinar coming up maybe this week around drowning prevention. But out of curiosity, are there other resources and support that would be helpful to us, or anything that you're aware of that we could share with the group? And Keisha and Ashley, I noticed that you joined the call as well, so if there's anything from CDC's perspective that you'd like to share, we'd love to hear it as well.
Yeah, right now there are a lot of different resources, particularly with drowning prevention. I've had a lot of interest also lately with ATV. I know like Safe Kids worldwide is having a drowning webinar on the 27th next week. There's several different initiatives that have launched different online social media campaigns and branding. So I would have to flip over. I'm on my little bitty laptop at home right now, but otherwise I would jump over to another screen that doesn't exist here and pull those up and share them with you. But there's several different organizations that have some wonderful resources going into the summer trauma season. So I think we've been talking about, really working on that strategic communications plan in a comprehensive way. We always make sure that different things are on our radar, and it's like, okay, these are the topics we could talk about, but really spending this time to get really strategic about it. And again, looking at it through a different lens where, things may be different. Like I was asked to talk about swimming pools. It's like, well, are swimming pools going to be open? How are we going to keep the kids 6 feet apart? I'm like, I don't know. I don't know the answer to that. So, just reminding people though that things are going to look different, and just give grace to everyone as we work through this.
Yeah, I think the uncertainty and unknowns, like you said, make it necessary to to be flexible in how we approach our field is going forward. I know in Colorado, in our branch, we do a lot of work around economic security and supports, just because that's a priority area of ours. And I think given the economic situation, and when there's going to have to be a continued conversation around how we continue that work going forward, and because a lot of that has been in the lens of primary prevention. This morning, Kate Cohen and I were and Rachel too, were on a call with someone from Safe States, and just talking about that. Oftentimes when we talk about economic stability and support, it's around making sure that people have access to assistance before they experience violence and injury. And the shift now is like, making sure that people have that access. I guess it still is in a way a primary prevention, so that there's not future impact to our topic areas. So so just the continued need for that.
If I can jump in here, and some of these may exist, I don't know about you all, but I feel like there's a lot of amazing resources that are popping up, and part of the challenge is just like keeping track of what's out there and getting to it. But I'd be really interested to know more about like the policy and advocacy issues and the response, the funding, the relief funding that's coming through, and to what extent is any of that, is injury and violence part of those conversations? I know we're concerned about suicide rates, things like that. And I would love any resources on what that looks like, what those conversations look like, and what opportunities there may be. And also the equity elements of this, I think, are really important, and the way certain communities are being hit really hard by COVID, and are there strategies around policy and advocacy to ensure that the prevention work that needs to happen is also coming to those communities.
Yeah. Are you, Sarah, when you mention around the relief funds, do you mean coming from even the federal level, or?
The federal level, I mean, I know a tiny little bit about how it's sort of filtering to the states, and it seems like there's still a lot of open questions about what states are doing with what they can do with the funds, how it's getting out the door. And I don't know if there are elements of this that relate to injury and violence, but right now I feel like the economic security all relates to injury and violence too.
Mm-hmm.
And so kind of thinking about it in a holistic way.
Definitely.
For these, and thinking about the kids who are in families that are really struggling right now.
Yeah, definitely. I just was asking because I receive periodic emails from Paul Bonta, who's the government relations. I don't know what his full title is, but he works at Safe States Alliance, and I actually think that there's a sign-on letter right now for, I don't know if it's like another stimulus package or another relief fund, but it's around increasing funds for injury and violence.
Okay.
So there is, I think, some consideration, but if that's an area even that that we could even ask him to join us on a future call to provide us with some information around what that's looking like. At least his knowledge is more at the federal level, but I don't know exactly how that gets disseminated to states, if it's through agencies like CDC, and does it look like competitive funding opportunities, or does it get incorporated into existing funding that states receive? So if I learn anything, I'm happy to share that with this group as well. And then, yeah, I agree with you on the equity impacts. We know that COVID-19 is definitely hitting certain communities much harder than others, and so. And I think part of that too is better tracking that data as well. And I know, at least in Colorado, now they're trying to improve data collection for which communities are being hit harder. And then, as you said, around the economic hardship piece, that may disproportionately impact certain communities. So, thanks for sharing.
Colleen, this is Barbara.
Go ahead.
I will say that I heard secondhand that injury and violence within the CDC Center is very visible, because the center director, Dr. Oury, was the deputy incident command for COVID for at least 30 days, if not longer. And I think she may have just rotated off of that position. So at least internally within CDC, the rumor is that she was able to raise the visibility and the connection of injury and violence related to COVID. So again, if federal funding comes, you could talk to Paul at Safe States about that, but if funding comes, it depends on when it expires and what distribution mechanisms. So if it expires quickly, they often, and comes to CDC, they often use existing mechanisms like existing cooperative agreements. But again, that depends on the purpose of the funding and when it expires. So interesting conversation. I'm so glad I was available today.
Yeah, thanks for joining. Yeah, that's a really good point, and I think that is something that Paul had mentioned on another call I was on with him, is that the thing about the stimulus packages is that they're often one-time. It's one-time funding, and so it may be for a short-term response, but then but I think if if we're expecting like a secondary wave or like a continued wave of the impact, or as we start to understand the data more, that this will likely be something that we will need to consider with prevention activities beyond just one-time funding period or just this year. So. Are there any, we have a few minutes left, are there any final thoughts or questions that people have, or any follow-up? Okay, well, thank you for participating in the conversation, and I'm sure that it's happening in your own states and jurisdictions, and I know it is for us too. So I think let's continue talking and learning together on how COVID-19 is impacting our work and you know what we can do for peer learning and networking going forward. I just saw something in the chat. Oh. Okay, so just to wrap up, our next learning opportunity is Monday, July 20th. If there's anything in particular that you would like to discuss or talk about, I'm happy to consider that for a future learning opportunity. And or if we want to continue this conversation or check in, that would be helpful, I think, just because I think we'll still be navigating this 2 months from now as well. Any final thoughts or questions? Okay, well, you know how to reach me. I'm always available, and I will follow up with the information from Kevin and Shelly in Texas. And I think it would be cool to see some people from our group participate in some of those. All right. Thank you all, and have a great rest of your week, and a happy Memorial Day.
Thanks, Colleen.
Bye.
Thanks, Colleen.